Good afternoon. We continue to follow very closely the situation in senior residences, but we're still lacking personnel. Today, I'm asking every available physician, generalist or specialist, to come and help us. We need you to do the basic work. I appeal to your sense of duty to help us take care of the elderly. To the rest of the population, the situation will get better. Courage, everyone. Good days will return. Thank you all.
Mrs. McCann, can you just repeat in English what you said about the humanitarian effort that's needed and the appeal to specialists to help out?
Yes, what I said is that we have many physicians who go every year for humanitarian missions outside of Quebec in other countries like Africa, but other countries too. And what I'm saying is that this year now, I think the humanitarian mission is here in Quebec in our long-term facilities. And as the Prime Minister said, we need them. We need them to come and help us and help the nurses, help the orderlies, help the whole team in those long-term facilities, that this is the humanitarian mission that we have now in Quebec.
Okay, thank you. And Mr. Legault, criminal background checks are done on employees and managers in seniors' homes in order to protect the seniors. How is that the owner of Heron residents could get licenses to operate multiple long-term care facilities?
Yeah. Okay, first, it's unacceptable for me. If it's really the truth, I've asked my people to check how come we have some background checks for employees, but not for owners taking care of elderly. So I was surprised to hear that. So I've asked them to check and to see if there are other cases.
Cathy Sonnet, CBC News.
Good afternoon. How would you qualify the situation you're going through, Premier Legault, when you practically have to bend your knees to convince physicians and specialists to help out in CHSLDs?
Well, it's a tough situation. Like I explain often, we had some shortages before the crisis. Right now, we have many employees that decided either they are infected or they are scared of going to the CHSLD, so they stay at home. So the shortages are bigger than before. And unfortunately, the main reason for those shortages are because we don't have enough nurses, we don't have enough employees qualified. Why is that? Main reason is because the job is not attractive. We have to review the salary. Mr. Barrett tried to do so in 2015. He said that he was not successful in doing it because it's not easy when you negotiate with unions to have an increase of salary that is different for certain types of employees. So it's not easy, but I want to do that. I said it since long time that I want to do that, have a better increase for those employees in order that the job be more attractive. And because it's not enough attractive, the people that are with shortages working day to day, the job is tougher because they have to work more because there's not enough staff.
Had to remind physicians and specialists their sense of duty today. You had to go as far as this. How? Why?
Because we know we don't have enough nurses in Quebec.
They don't answer the call.
Sorry?
They're not answering your call for help?
Maybe I was not clear enough because what I heard this morning from the two president of the two unions, they said there's no lack of doctors in CHSLD. That's not what I'm saying. I know that we have all the doctors to work as doctors, but we need nurses, and they can, with their basic training, they can do most of the job of nurses. So I'm asking them, please, I know that you're overqualified to do this work, but I have no other choices. So I need physicians to come in our residences to help the nurses.
Okay. My last question.
Go ahead.
Thank you. Mr. Arruda, I have a question from one of my colleagues. Families of residents at the Montreal Geriatric Institute and also the unions are saying, because of the initial directives for testing, remember, it was people who traveled, those directives blocked them to basically know better the prevalence of the COVID-19, the outbreaks in their own institution. So do you have the impression that the directives were too restrictive in the initial approach in Quebec, and that did contribute to the spread of the COVID-19 in seniors' home?
I think that we must remind the issue of the number of tests that we have at the beginning. The choice we made to go to traveling people, it's because the risk was there. And we had to search and contain that risk. And I think that if we had the test unlimited, we could have tested all Quebecers at the extreme. But I think what introduced more probably the virus into the healthcare, long-term care facilities is probably asymptomatic people or visitors or doctors or nurses that went into that and make this situation. I'm not so sure that I've been testing one time also at the beginning those places that people would have been infected. It takes time before it gets in. So it's a very complex issue, and we always have to adapt it on what we have as a capacity. It's clear we're going to do serologic new things, but remember, at that time, we only had one center being able to do tests, and very fast we went to more than 19, 20 hospitals over that. And we now have the capacity more than other provinces or countries. I think the decision was the right one at that time, because we didn't have this capacity that we have right now. And this is dynamics. And, we are looking at the evolution of the situation and decide the priorities always goes on relation to what we look for.
Thank you. The next question is from Raquel Fletcher, Global News. Does the Premier really want doctors to go feed and change people in CHSLDs rather than accept help from the rest of Canada?
Do they want? Sorry.
Rather than accept help from the rest of Canada, if you really want doctors to go feed and change people in CHSLD?
No, I said that if we can get some help from the Canadian Army with people that have the training to do this work, I will accept this help. But right now, until a few minutes ago, I didn't have this help. They are maybe talking about 1,000. We need 2,000. So I'm asking doctors to come and help work as nurses in our CHSLD in the meantime.
And as a second question, some seniors are complaining that supermarkets and pharmacies are preventing them from entering to purchase essential items. These seniors have no other way to get to the things they need, and some don't have access online. Are stores allowed to bar seniors?
Okay, no. It's unacceptable that we bar seniors. First, it's important to repeat that there's no more risk with senior people to get the COVID-19 than with younger people. The only question is we suggest the seniors to stay at home because they are at risk, so it's for their own good.
Thank you. Next question are from Philoté Montreal Gazette for Mr. Legault and Minister McCann. We are hearing about healthcare workers who want to come help in the CHSLDs, but there is no follow-up when they volunteer. What can you do to cut the red tape?
Oh. Well, we're really working with everybody, and I want to tell you that in this crisis, there's hardly any red tape. There are some situations that we would like even to go faster. There are some steps to do, but we're working so fast. What we're doing now, we're doing in a couple of days what we used to do in a couple of months. So, no, we want everybody, and we're looking everywhere in all the health workers' domain. And if we haven't seen someone who would like to come in and help us, please let us know, and we will very fast make it that these people will be able to help us.
And as a second and very last question, we are hearing from families who say they are still workers in senior residences who are not being tested for COVID-19 and risk infecting residents. One union, the CSN, says they would like a list of test workers. How can you correct this?
I'm not sure I understood the question. Could you repeat the question?
Yeah, we are hearing from families who say they are still workers in senior residents who are not being tested for COVID-19 and risk infecting residents. So one union, the FSS CSN, says they would like a list of test workers. How can you correct this?
Well, we will certainly contact them as I want to mention that the head of my cabinet is in contact with all the unions every 2 days. So I will take this preoccupation and will ask that we call them to really understand exactly what the situation is.
So thank you very much. That's all the time we have. Merci tout le monde. Bonne fin de journée et à demain.